The functions of our new EHR will help with practice management. Electronic healthcare records will be more customized and will also have medical forms online that patients can use along with their own patient portal. Support information will be available for providers to share with patients, as well as provider to provider contact. This will reduce data collection and storage costs, and will also merge technologies with providers across the country and across the world. Our patients' intake and rooming time will be decreased significantly, as well as clinical charting will be able to increase our patient engagement with our providers. Medication compliance will be increased because our patients will have access to the MediSafe app along with our providers, which is cloud-based. This system sends notifications to our patients when to take their medication intervals, as well as support for any possible medication interactions, allergies, and reminders that are sent to our patient and the pharmacies on when refills are available. Telemedicine is a huge influence on how we proceed with our business nowadays, because it gives real-time patient care, which is checked by our insurance before the patient has their online appointment with their providers. Financial billing and business management will be able to increase business intelligence reporting. With this new EHR, we will also have social media interaction. Now, the main concern about social media is that there will be a lack of HIPAA compliance. Now, HIPAA must be maintained. Above all else, we must make sure that our patients have the confidentiality and privacy that is required by law. This will ensure that all staff members and providers and hospital employees will comply with legal professional regulations and standards. Now, according to Health Information Privacy Code of 1994, health information has to be used for its intended purposes and shared with individuals who have the need, such as providers, staff members, and patients. Staff members can use a public platform and social medias, but they must ensure that they use professional judgment regarding the risk to themselves, their colleagues, and patient privacy. And there could be accountability to these individuals. profiles and content of our social media will be reviewed by the ICT department. And evaluations will be conducted for our privacy policy effectiveness to reduce patient complaints and incidents. Hospitals will also have an audit completed by ICT, which will show the digital footprint of our staff members. Social media is a wonderful thing, especially when it's used appropriately and professionally. This gives positive interaction between patients and providers. This also strengthens new relationships between patients and providers, as well as maintaining their current relationships. This allows for gaining and sending information between individuals to help communicate and connect with similar interests. It increases healthcare workers' awareness about services, education, health promotions, and preventions that our patients also need to be aware of. Now, due to the increase in social media, all information is sent faster than before when hospitals and corporations used mass media. One aspect of social media that I really love to talk about is education. Now, smoking cessation is a huge part of our culture, especially since the federal government implemented the new law at the beginning of this year, stating that it was illegal for individuals under the age of 21 to use or buy tobacco products. This also is part of the fact that it is illegal to sell or buy for these individuals. Now, there is a social media site called the Truth Initiative, and this is geared towards our teens and young adults who were able to use tobacco products but now cannot, and this will also help them to stop smoking because it is all online and it's a social media platform. There's also the app for this site called This is Quitting, and individuals can use this app on their home computers or on their phones. And this and other apps actually help to increase the quit rates across the country. Social media has many different parts to it. There is social networking, which I actually reviewed several sites, and one of my favorite was carebridge.org, which is a private site for healthcare providers and patients, and it gives healthcare information as well as status updates of patients. Blogging is a huge part of social media. I've seen several sites. One is canfid.org, which is developed by providers and researchers in order to send out more health information so that the public is more educated. Microblogging, Twitter, is instant communication across all disciplines and people. Social bookmarking and pinning, well, Pinterest or Reddit, gives patients the availability to tag information and also to collaborate between themselves and providers. And video or image sharing, YouTube, Instagram, is another part of social media. This type of social media has concerns because the videos can be made by non-medical professionals, and people will use the information put down. It may not be accurate. So we need to ensure that our patients really review the information on social media before they start to use it. Before I go, I'd really love to add some facts and some statistics. 40% of healthcare consumers are influenced by social media. The age range is usually 18 to 24, and these individuals are twice as lucky to seek guidance from social media before they visit a hospital or contact their provider. 31% of healthcare organizations have specific guidelines or policies that staff must do what is necessary to protect our patients, as well as the hospital and each other. Trust information crowdsourcing, which is patients receiving information from their healthcare provider using online sources and groups. 54% of patients nationwide use this type of social media. 41% of people say that social media influences who they see for their healthcare needs and where. And 60% of physicians use social media to improve their quality of care for their patients. These are statistics, and as a provider, as well as a patient, I can tell you that I use social media as well as I use online sources for certain aspects of my health. But we also need to let our patients know that our providers and staff are doing everything that they possibly can to improve their quality of life. So I wanted to thank you all for giving me this time, and please, again, be safe during this difficult time in our nation as well as the world, and take care of yourselves. And thank you for doing everything that you do. Have a wonderful, blessed day.